Meningitis is the inflammation of the meninges, which is the inner lining of the brain and spinal cord. Now, the meninges are comprised of 3 layers, sort of like a bean dip. We have the dura mater, the arachnoid mater, and the pia mater. This inflammation can cause massive swelling in the cranium, putting loads of pressure on the brain itself, and even leading to very deadly increased ICP, that increased intracranial pressure, that sort of squashes the brainstem and kills the patient. Now, the causes of meningitis are very simple, typically due to infection, head trauma, or even an autoimmune disease like lupus. But infection is the most commonly tested since it's the most common cause. So for infection, we have 2 types: viral, which is the most common, and bacterial, which is far worse since it's most contagious. So the memory trick we use is bacterial, think bad news, since it's the most contagious. And for viral, just think very common, since it's the most tested. Now, it spreads by being exposed to another infectious person. Very common in college dorm rooms where we have tight quarters, or even in hospitals like after surgery. Either way, it invades the CSF, that cerebral spinal fluid, within that subarachnoid space, causing major swelling and inflammation. Now, the key signs and symptoms to look for, think of the 3 H's, since it affects pressures inside the head. H for headache and photophobia. H for hard neck, known as nuchorigidity, and H for high temperature. We typically see a high fever due to the infection. Click here to check out our brand new app-based NCLEX product, loaded with the highest quality NCLEX style practice questions, and complete with detailed video rationales that break down the question for you. So finally master all those darn select all that apply questions. Plus, all our NCLEX memberships come included with our entire library of over 1,000 videos and study guides and cheat sheets. Come see why over 100,000 students have trusted their future to simplenursing.com. Click here to get started for free. Now, for pediatrics, our little babies, the 2 classic signs are a high-pitched cry and bulging fontanelles. These are typically the 2 most tested classic signs for ICP and meningitis in our pediatric patients. Now, in our adult populations, increased ICP is typically seen as agitation and altered level of consciousness, that mental status change. That's typically the most tested first sign. This will eventually lead to seizures, coma, and death as the brain gets squished under all that pressure. But we cover all of that in the increased ICP video. Now, as far as diagnostics, the priority findings to report immediately. So guys, write this down: positive Kernig's and positive Brudinsky sign. So for Kernig's, this requires laying on the back and straightening the leg. It's very, very painful if the patient has meningitis. And positive Brudinsky's is when the neck is flexed, the hip and knees also flex too, kind of like folding a beach chair. So the memory trick is the Kernig crinkle. When the knees are straightened up, the clients crinkle up in pain. And the Brudinsky beach chair is the other memory trick. The body kind of folds up like a beach chair when the neck is flexed. Now, Kaplan had a question about this, asking a client with suspected meningitis, when the neck flexes, the hip and knees also flex. What is the priority action? So this definitely sounds like a Brudinsky beach chair to me. So the answer was to immediately report the finding to the HCP. Now, as far as imaging, we do a CT scan that is done before a lumbar puncture, since a lumbar puncture can worsen that ICP. So we do a CAT scan to kind of rule out that increased ICP by simply taking a picture of the brain. Now, as far as LP, our lumbar puncture, also known as a spinal tap, this test is done to test the CSF, that cerebral spinal fluid, for infection. So the rule of thumb is viral is very clear CSF fluid, and bacterial is very bad, cloudy fluid. Now, both will have elevated WBCs, that white blood cell count, since there is an infection inside the body. Now, as far as nursing care for an LP, before the LP, we tell clients to empty their bladder. During the LP, we have the client round their back by simply putting their knees to their chest like a cannonball position, or over a bedside table to round that back. Now, don't let the NCLEX trick you here. Clients will never be prone or basically on their stomach. They'll always have a round back. Now, after the LP, the key term to write down is we monitor insertion site dressing for clear fluid. This means that leaking CSF fluid is coming out of the patient, and we must report this to the provider immediately. That's the biggest key term there. Now, as far as nursing interventions, the first action for any client suspected with meningitis is to place the client on droplet precautions. Not to check for Koenig's or Budinsky's sign, we always do this after the client is placed on isolation. Always remember, personal protection comes first. Now, a little side note here. I know droplet and airborne precautions can get a little confusing. So user memory tricks PIMP for droplet precautions and MTV for airborne precautions. So just think you're on air with MTV, like music television. And think of Pimp My Ride, like that old TV show, when you're dropping your lowrider really low. So for droplet precautions, P is for pertussis, I is for influenza, that normal flu every year, M is for meningitis, specifically bacterial, and P is for pneumonia, basically pneumonia. And for airborne precautions, M is for measles, T is for TB tuberculosis, and V is for varicella. Now, a lot of test questions come from PPE here, so write this down. For droplet precautions, number 1 is surgical mask and goggles, and number 2 is a single room. Now, ATI mentioned that we teach unlicensed personnel to wear a mask. And for airborne precautions, the number 1 thing is staff must wear N95 masks. The patient has to be in a negative pressure room, the door must be closed, and here is a tricky one, write this down. When you're transporting the patient must wear a surgical mask. Now, a few different textbooks had different things to say about this, but overall, surgical mask was the most recommended when a patient leaves the room. So guys, write that down. Not N95, but surgical mask. Now, a little side note here. Don't let the NCLEX trick you here with those fundamental questions when you're putting on and taking off PPE. So when you put on or don PPE, just think the gown goes first, the mask second, goggles, and then lastly gloves. And it's almost the exact opposite when you're taking off or doffing. Gloves are first, then the goggles, and here's the tricky one, the gown third, and then lastly the mask fourth. Okay, now after the PPE is in place, then we take labs, specifically taking blood cultures first. And then we give antibiotics second, within 30 minutes of admission. So the memory trick, think antibiotics we give after the blood cultures are taken, for bacterial meningitis, of course. Now the NCLEX will try and trick you because they want you to prioritize, asking for a priority action if a client slips into this septic shock from meningitis. So a common NCLEX question. Client admitted for bacterial meningitis with a really low blood pressure. What is the priority action? So the first action that you should take is to administer the bolus of IV normal saline, that isotonic fluid. Not giving IV antibiotics first, and definitely not calling the provider. Priority here to save the patient's life is giving fluids. Now, the NCLEX and nursing exam are all about prioritization. So just think, what kills the client first? That low blood pressure will kill, and this is prioritization in terms of ABCs. Since C is circulation, that client needs a bolus of normal saline to bump up that blood pressure. This is priority. Now, lastly, let's talk about the low lows to decrease that strain on the brain. We want our client to be in a dark, quiet place. So write this down. Low noise, we need a quiet room. Low light for that photophobia. And low pressure all over to decrease that strain on the brain. So no coughing, no sneezing, and definitely no bending the extremities. We want to actually raise the head of the bed at least 30 degrees to decrease that pressure on the brain and to decrease that increased ICP. And we monitor for signs and symptoms of worsening increased ICP. Remember, the earliest signs, huge NCLEX tips here. Altered level of consciousness with restlessness, irritability, and agitation, as well as decreased mental status. You guys better write that down. We have an entire video on increased ICP, but this sign is typically the most tested since it's the earliest sign. And on the NCLEX and even in your nursing career, early detection prevents the most injury. All right, guys, that wraps it up for this segment. Don't forget to take your quiz and download the study guides. Thanks for watching. For our full video and new quiz bank, click right up here to access your free trial. And please consider subscribing to our YouTube channel. Last but not least, a big thanks to our team of experts helping us make these great videos. All right, guys, see you next time.